Hello, and welcome to today's continuing education webinar, Best Practices in Client Engagement and Payment Capture for Veterinary Clinics. Thank you for joining the session. A little bit about me. I am the Executive Vice President here at Rectangle Health, and I have spent the last 8 years dedicated exclusively to the healthcare community with a focus on working with and educating providers on how to maximize cash flow and enhance efficiencies at the practice. I believe that through the use of digital tools, offices and clinics can transform processes for the betterment of staff and client experience. And in my role today, I am grateful to continue to present this type of information through CE courses such as these, and truly believe that all practices can be financially and operationally healthy. Today, we are excited to talk about how technology and digital solutions can help your clinic or practice create smoother experiences for clients and staff alike through payment options and tools that will help automate workflows. I believe that practices have only just begun to tap into the benefits that a technology transformation can have on staff efficiency, relationships, and ultimately on cash flow. So with that, we'll get into the details now. Now is the time for us to really think about how much has changed in the last 24 months. And I know that it is impossible to begin this conversation without acknowledging all of you as veterinary caregivers. Additionally, we've seen the pivot to curbside care that so many clinics have made in response to the pandemic was truly extraordinary. Today, I'd like to capitalize on that type of change and discuss how to identify and recognize the need for this type of technology and continue down the path. We'll talk about finding the right solution and setting aside time and resources to implement new technology. I will also share firsthand experiences from providers and administrative professionals who have recently completed a technology transformation and their practical advice for successful implementation. We found that clinics often have competing priorities while running an office, and often it's simply because the current way of doing things is familiar and current system and processes seem to be working out well enough. The thought of implementing and training staff on new protocols or processes can simply be overwhelming. But while clinics might get by with the status quo, they miss out on many benefits of enhanced technology, such as strengthened client loyalty and a much healthier cash flow. We think about the office workflow or care journey in 3 stages: pre-care, point of care, and post-care. There are opportunities at each of these stages that create a positive experience and open up the opportunity for a client to make a payment. Technology certainly helps make this possible, and we'll talk about its role in each of the windows. Let's start with pre-care. The option to fill out forms digitally and receive email and text payments notifications have just blown up in a positive way over the last few years. And studies and statistics show that clients are willing to shop around for providers who offer these digital tools, including communication and registration, digitally. While we have all been in this position, rushing through paper forms at the waiting room to get information down before an appointment, and when we can digitize this, making it available for patients to access these forms online, the information that is entered is usually much more accurate, and it takes away that cumbersome need for a printer to print it out, for people to exchange clipboards and pens, and countless times I have forgotten to bring my forms or fill out my forms. Doing these things digitally, I can do them from the car, I can do them in much more convenient ways. So the pandemic really did put a halt on the waiting room and eliminating many of these everyday items that we touch, transmitting germs, making this transition to digital fairly straightforward as a case study. what we are seeing is that a lot of our clients are interested in making the transition to digital methods of communication. And for those who may not have made the change, we're seeing a large percent actually start to do so even now. And even though these links to digital forms can be shared through text and emails, sometimes we hear that perhaps practices feel that their patient base or their client base may not be apt to agree to do things electronically. But I think that is definitely changed, and we see that there are no more generational gaps in types of digital communication and registration. So whether clients can fill out forms using their computer, their tablet, or their phone, when it's convenient for them, it is absolutely creating a positive experience. And the workflow also helps staff manage patient flow, client flow through the office, improving the accuracy of patient and client information. And then we can also see these methods adapt to virtual visits if that is something that is also being offered at the practice or clinic. When you're gathering patient information digitally, secure solutions also exist to let patients place a card on file ahead of their appointment. Offering card on file up front is also a practical way to start payment conversation with your clients early in the care journey. For many providers, revenue cycle management and receiving timely payments are major concerns. The traditional payment model is breaking down, and unpaid or outstanding balances build up to staggering numbers. It's commonplace that when you send a follow-up statement, including a balance owed, many go unpaid, and providers are left chasing after those payments. The accounts receivable is elongated, and unpaid bills must be written off or worse, sent to collections. None of these are good for the health of the clinic or the relationship with your client. And this is why storing a patient's preferred card information through our secured technology is a practical way that providers can ensure that they receive payment for services rendered and simplify the checkout process. Having your clients put their card on file is ideal for revenue cycle and for operational efficiency. And the earlier in the process you can collect their card, the better. If you implement the electronic registration process, often you can collect this information before they even step into the office. They can even fulfill payment responsibility without ever exchanging a physical card. This also exists to help patient and client loyalty. With cost being such a burden and challenge, we are working to provide ways to offset expenses so that when you're considering technology and tools that make it easier on clients and staff, wrapping this into one workflow really starts to make sense. And it's also been studied that retaining clients are much more impactful than finding new ones. And if digital communications are client preferences and it makes the life of the staff even easier and less manual, let's continue to review how we can make that happen and what that means to the practice. One thing we get often asked is how client communication has changed and what are these new expectations? Digital communication has become the norm in everyday lives, and now we're seeing that this is the preferred way people want to be communicated with. And for clinics, we believe this is a benefit. Opening up digital conversation with your clients and including outstanding balance or payment information is very important and can be easily put into a text message or email. Making it part of your office workflow to talk to patients and clients about their preferred methods of communication. As part of the technology solutions, you can send text messages, you can give details about upcoming appointment reminders, and this shift is having a big impact on practices, obviously improving cash flow, strengthen relationships and loyalty, but also keeping phone calls down to a minimum. Not many people want to talk by phone anymore. And one of the things that we're seeing is that patients and clients also want to see text messaging because they are not checking their voicemails. This is an efficient way to communicate and is seeing a high success rate of reaching clients. they are absolutely preferred over phone calls. And we are seeing not only a high open rate, but people take action right from their phones when there is a specific thing for them to do, whether it be confirm an appointment reminder or even pay directly from a payment link. With certain technology solutions, those text messages can be sent from an office staff workstation, making communication processes seamless throughout their current workflow. So what it means for the office truly is, like we said, believing that there are more ways to offer convenience, and this technology serves to easily communicate, freeing up staff, and is absolutely the more preferred way by clients. One of the things that we hear often is that this text messaging opportunity unlocks a new channel, but is also very personal and unique to the client. It does not have to feel cold. A lot of times we do hear that practices and clinics feel that there are ways to essentially feel like technology replaces conversations, but I don't believe that's the case. Take a look at some of these messages here. These are very specific. You can make sure that you can use their pet's name in the text messages. You can be very specific about their treatments. So I think that it is not cold, it is not impersonal, but it is absolutely somewhat a very easy and effective way to share announcements, reminders, follow-ups, and billing information. So what is the best way to capture payments from your clients? When we're talking about changing things over to become digital, we think about how we pick up our groceries, how we purchase something from Amazon or receive a notification about a monthly bill. Each one of these types of processes are convenient, and they're built in with automation to make it easier for us as consumers to pay for our everyday purchases. Why not have that same option at the veterinary clinic? Similarly, these are more modern practices are looking at enabling technology to make it easy and convenient. This is where changes can seem to and be very liberating for our staff, and where offering various payment methods can absolutely help. One thing that we feel strongly about is the opportunity to change a lot of our follow-ups to online, and that portals are time effective, they're convenient, they increase communications, they actually operate to serve your clients 24/7. So even if your practice or your clinic is not open, think of the website as an extension and as a way for your clients to interact with you, even if you're not open. It's a way for them to pay, refer others. It's your vehicle, your website is a vehicle to carry vital information. You can make content available. And this way, if people are searching the web for information, looking for clinics to bring their pets, this is happening at a higher rate than any other time in history. So optimizing your website and having all of these digital tools at the client fingertips is imperative. Over 90% of website traffic goes to the first page, and sometimes almost 75% people don't even scroll past it. So what you want to do is make sure you put the most important information on your main page, including schedule now and a payment link. Providing the ability for your clients to pay bills, purchase medication, treatment formulas, grooming items online is an essential best practice. And as an extension, we can also talk about mobile-friendly options. I think that one of the most exciting things that we saw was the ability to go curbside. So we think about mobile-friendly options as an extension of your digital web footprint, and another way that's essential for your clients. Practices can open an online website portal. You can add, like I said, information to your website. And one of the things that we also are seeing is a QR code for the client to scan, whether it be to go right to a payment link, whether it be to go to fill out forms. QR codes are exploding all over in our practices, in our clinics, as ways for us to stay contactless and convenient. So if the office is sending a text message to a client, you can send a link, you can copy a QR code right through that communication. While handing off the pet to its owner, the vet or staff member can ensure the client received the text message and they can successfully submit payment before parting ways. Extending card on file and text to pay is the key to seamless curbside care, ensuring that this checkout experience is painless. Paying by phone or using my card helps me as a pet parent to get in and out of the office faster, especially when my hands are tied up with leashes or juggling a carrier, and I'm relieved to not have to pull out my wallet. Here are some examples of ways that our clinics are interacting with pet parents. And just to give you an idea of what this looks like, you put this information at the ready for clients, right? For them to go to a mobile friendly checkout page, making it easy and quick. Pet owners are consumers, and in today's consumer market, there's no shortage of payment methods to make a purchase possible. So we see that even extending a payment plan offering, practices can make treatments possible that clients may not have been able to access or go through if we make it small and we pay over time. Payment technology that includes card on file capabilities gives veterinary practices the ability to offer payment plans to establish clients, breaking down larger payments over time. And they offer this way to create parameters of this payment program, whether it be collecting a minimum balance due, and then making it in chunks over time. These are ways that you can work with your clients in order to get them on the right treatment path, affordable care, and giving the financial details, and it's a relief. And oftentimes, and what we're seeing is a lot of consumer preferences for what we call buy now, pay later. You may see it on some checkout instances. So when we see those types of trends in the consumer market, we like to make them available for our practices and our clinics. And a lot of statistics are showing that this is the way people want to pay, that they need these options, and it will help to start a treatment that they may not be able to or be hesitant to begin. But we also hear a lot of concern from our practices that people will actually pay when they sign up for these types of payment plans. I believe the answer to that is flexibility, and you can often get a signed agreement from your patient or client. And one of the practices that we work with had to do a lot of manual effort to follow up with the client after they set up a payment plan, and it was very manual. And when she and I talked about the recent technology transformation that they went through, automatic payment plans was one of the things that she mentioned that has freed up a significant amount of her time. So instead of following up with a phone call for anyone who had a balance, she kept a card on file, and then they would just automatically go out so that she wasn't having to call them anymore. The card would run every single month, and they didn't have to do any manual effort to remind the client to make a payment. When we think about what technology offers the staff and administration, I think about this as a way to ensure the staff is not tied up by doing manual processes or significantly reduce manual data collection or input. And our clients have told us that one surprising benefit has been this boost in staff morale and improve camaraderie at the office when they implement systems that actually take some of this burden off of the staff. And one way that we do that through automation and through technology is by making it so that offices can create a convenient checkout process and encourage payments through an experience like we do every day and in a retail setting. So when the pandemic occurred, it only strengthened the preference for convenient and contactless methods. So when you have workstations set up so that everyone can process payments and offer things like digital wallets or tap and go, Apple Pay, Google Pay, these wide range of patient payments and client payments gives options so that people don't have to pull out their wallet, or they may be able to actually connect with the clinic to do in such a way that they have more convenience and preference. We certainly hear about automation as a buzzword these days, and one of the ways that offices use technology is with tools that interface with an existing patient management system, specifically when the payment can automatically post to the ledger. We're seeing that this truly increases office efficiency and reduces manual errors. So having an automatic way to sync payments between systems removes the possibility of error, ultimately means a more accurate reconciliation and better client and staff satisfaction because it keeps up-to-date information. It does help to truly free up the staff so that they can connect in with their clients to talk about whether it be, pet health, whether it be situations that they need to review after treatment. And then the other thing that we often see is that this ease of reconciliation occurs because of this automation. And when reconciliation and reporting, they're necessary tasks that all staff and managers need to do on a daily basis. So something easy as simply finding a receipt to issue a refund can be simplified, and simplified means reducing stress levels, and that it frees up the staff to focus on more meaningful tasks. So these are some direct quotes from some of our clients, and we'll also talk about how there's one more that I feel is very important for us to discuss, and it's something that is very meaningful to me, speaking from experience, that as we eliminate areas of friction or of difficult conversations at heartbreaking moments, imagine if technology could be there to serve and make things just a bit easier for the staff, especially when it matters the most. So I just wanted to share this quote from one of our clients. So we reviewed how technology solutions for digital registration, communications with your clients, and payments all work together to create an efficiency that digital technology is there to lean on to make things faster, easier to manage, and it can actually interface with your patient management system so that you can populate information and save the staff time and effort. And when we can save time from manual, tedious processes, this allows your staff to focus on relationships and more specific revenue generating activities that will actually serve to get your patients and their pet parents in and out of the clinic quickly. One of the questions we get asked more often, especially in regard to taking payments, is security. And with clinics like yours relying increasingly on technology to improve workflows and connect with clients, mitigating cybersecurity risk becomes yet another top priority. Half the battle of implementing protective measures against cyber threats is recognizing which have potential issues and which ones need to be addressed, how to be best preventative from them before they create any type of crisis. And human error has surpassed malicious activity as the most common data breach and threat to the sector. So I would like to go into detail about how becoming aware and proactive in dealing with these risks can save your organization from security issues. So there's a lot of information on this slide, so I'm going to go through it slowly and just talk a little bit about that. What we see is that misdelivery, which can really occur when internal stakeholder or internal staff mistakenly sends information to the wrong recipient, whether by traditional paper or by email. So these are one of the several ways that your practice or clinic can monitor and work to prevent any type of threats. So, this type of human error is common. It can result in a breach, information that falls into the wrong recipient's hand. We lose the control of confidentiality. So personal information is, one of the things that is often subject to misdelivery. Hacking or IT incidents is another. This is a category by which something that you may be familiar with called ransomware falls, which has been persistent in all types of healthcare organizations. And, this type of ransomware is malware that encrypts files, rendering them inaccessible to the owner until a ransom is paid in order to decrypt them. Insider threats come in many forms, from human errors made to malicious attempts to access and sell data. Internal actors is what they're called, often bypass traditional security protocols, either by mistake or with malicious intent. And these breaches can be costly and difficult to anticipate. Insider threats encompass a variety of employees, from those unknowingly clicking on malicious links that compromises your network, or even losing a work device that might contain sensitive data, to something unfortunate like purposely selling it for profit. Phishing attempts often disguise themselves well. They're getting smarter and smarter every day. So educating employees to make sure that they are very careful on what links they click on, making sure that they know that it could look authentic, but in fact be malicious. So one of the things about phishing attempts is just to encourage employees to question and verify a website or link or email sender that is in fact true, is a very important way for you to protect your organization from this type of cybersecurity threat. While all clinics and practices are at risk, some are more protected than others. And when it comes to security, it is well worth the investment of time, energy, and finances to ensure your clinic is well guarded. And one way to do this is to ensure that you carry cybersecurity insurance. This covers business costs associated with theft or destruction of IT assets. This coverage could include recovering identities and data that has been compromised. It could include paying for legal fees that may arise if in case any information is stolen. And while evaluating whether your organization may need cybersecurity insurance, you might want to consider the ramifications of not having it and the peace of mind that it could bring. Well, what else can practices and clinics do today? There's no insurance that can prevent human error, so it's important that your internal team is vigilant about verifying recipient information before sending any form of communication, keeping passcodes up to date, avoiding the temptation to click on distrustful links, and staying informed about suspicious activity that occurs internally and externally. According to Pci Security Standards, here are some other points of reference that you can do in order to protect your organization. Ensuring that you're meeting PCI annual compliance is probably one of the most important things that you can do. Ensuring and utilizing digital technology instead of paper for billing statements and communications is also important. Providing an ongoing education to employees, training staff to recognize phishing emails. These are ways that you can take proactive methods in order to reduce your risk. Some of these also are these technology and security are things that are important for you to be aware of, and they're considered trust symbols that when you talk about processing payments, these data security standards apply to you. There's a website that I can recommend called Pci Security Standards. This website is there for you to be a resource. They constantly monitor threats and give you easy and ways to think about improving your compliance. They do offer training, they do answer questions, and may be a very good resource for you to have. Typical challenges that practices and clinics alike see when they go to take a step towards implementing new technology. Despite clear pain points and benefits to the office, some groups perceive the burden of implementation as a time-consuming training process, and it creates hesitation for moving forward. This is completely normal. You may know that there's a need in the office, but you don't know how to start. Also completely normal. We hear it all the time when we work with practices. So we've gathered some experiences and advice from providers and practitioners, as well as a leading consultant, on what practices and offices can expect when you begin to research and implement a new technology solution. So one of the things that we like to talk about as a first step is identifying the root of some of your issues, whether it be cash flow or points of friction for your clients, whether it be specific areas, then researching the technology options that are available. You know, we talk about making a list of what would most benefit your practice. Don't settle. Look for tools that will solve all aspects of these points of friction, that will solve front office payment issues and back office issues. Listen to your team's input. One of our recent doctors said that for him to give up old ways in the administrative aspects of the office was tough because it always worked. And then he also went on to say that that's where he relied on his administrative staff and he trusted them. But it was an effort to let go of some things that he felt were just working just fine. When we think about how to implement new technology at a busy clinic, the challenge can be overwhelming, but setting your group up for success and improved workflows can far outweigh inconvenience for a small amount of time. And that oftentimes practices and offices reflect on the payoff, saying the only thing I wish we could have done was that we did it sooner. And beyond the solution itself, learning to talk about, to really understand the implementation process and the level of support that a technology vendor can provide with setup, troubleshooting, and continuous training is something that you can ask for and negotiate upfront. And the right provider will come alongside your organization as a partner in this process, knowing that sometimes just getting up and running can be challenging, but will help you to make sure that it is done smoothly and efficiently. A lot of times practices, like I said, become very familiar, comfortable, even though it's complicated by inefficiencies. And we saw from a consultant that, you know, sometimes practices will identify a clear need for improved efficiencies. They may shop around for solutions, but then it gets something that is pushed aside because there are competing priorities, demands, responsibilities, and now even more than ever, a lot of staff shortages, people needing to work remotely. These things are creating more and more of a challenge to find the time, the money, and the brain power to undergo a technology transformation. It can seem daunting. And while making this implementation can absolutely be something that your practice has to create as a top priority, you can harness that same drive and determination and adapt it to doing business in a new way. We've all been through so much in 24 months that I feel that taking that time and resources to adopt new revenue cycle management technology and office workflow technology is something that can make a tremendous difference to you and your staff. I certainly do hope that you can consider a digital transformation to accelerate and meet the clinic client demands and expectations as we move forward in such a quick way to these consumer-centric models. We've certainly felt as if the overburdened system was thrust into utilizing technology, but we didn't fail. We rose to the occasion. Things were made more efficient. We ensured physical safety, but we also can now do it at scale, and we can encourage you to continue to leverage that new technology, taking your clinic to the next level of client satisfaction and improvements in cash flow. And one thing that we want to impart to you is that you can start slowly and tackle the areas that are most burdensome at first. A digital transformation and strategy does not have to happen overnight or all at once. So if you have a high amount of accounts receivable, consider adding in text to pay options to expedite payments. If you have a clientele who is looking for Apple Pay or Google Pay so that they're not taking their wallet out, that they're just using their mobile device, they may just want to pay online. Ensure you have that at the office. Some clients want to pay online. They want to do it before they get into the actual clinic. Have a payment link on your website. You don't need to implement a digital strategy all at once. It can be done in phases. And I think that's most important, that people get scared away, and it doesn't have to be that way. So to wrap up, this is a quick overview of what we discussed and a reminder that the technology that is available really will help clinics reach new levels of convenience and efficiency and relief. We are looking forward to reaching the pre-pandemic levels of appointments and traffic once again. And I've read a really interesting quote this morning that said, "Successful outcomes are never the result of a single choice. They're built up through good choices made over time." And the writer went on to say that business efficiencies are never a choice, it's a series of choices. And that is my hope that as you reflect on what we've discussed today, that you consider what a single choice that you can start with today that can build upon ways for more efficiency, convenience, and more importantly, give you that opportunity to create space to connect with your clients and their beloved animals. And we think that changes like this will pay off over time. And I wish you all the most continued success, and thank you sincerely for all the work that you do to make our animals healthy. If there is time, we can have a Q&A and talk about what's on your mind. We thank you very much.